Here at Michigan Family Wellness, we believe chiropractic care and nutritional-based therapies are a foundational part of a healthy family lifestyle. No matter where you're at in the mitten, having a family is such an exciting time of life. So instead of feeling overwhelmed by stress, fatigue, and responsibilities with the kids, we invite you to become part of this empowering community to create happy, healthy families. By providing engaging interviews and practical applications, Dr. Wallner cultivates family health by equipping our listeners with the tools they need to elevate wellness in their own family. Dr. Wallner passionately serves the Michigan community at his chiropractic and nutrition-based practice, where he specializes in pregnancy, pediatrics, and family wellness care. And now, here's your host, Dr. Kyle Wallner.
Good day, families, and welcome home. That's right, my name is Dr. Kyle, and this is the Empowering MFW family, and we're so glad to be with you today. If you are joining us for the first time, I want to thank you for tuning in. The health of you and your family is your number one priority. It is your greatest asset. The best way to have a healthy family is by living a family wellness lifestyle. So, if you're looking for efficient, effective, and sustainable ways to elevate your health and the health of your family, then I strongly recommend you make yourself comfortable, because we have an amazing show for you today. And before we get to today's episode, let me say a few words, as I do each and every week, about Power Performance Gym. Power Performance Gym is dedicated to helping you achieve your best definition of healthy and strong. Power Performance specializes in strength and conditioning for individuals, small groups, and athletic teams, weight and pain management, as well as recovery and nutrition. Everyone at Power experiences a full movement and health analysis to build your blueprint for success, targeting your goals. Mention the Michigan Family Wellness Podcast to receive your movement and health analysis as a complimentary gift. Learn more about how Power Performance can help you move, look, and feel better by visiting powergym.com. That's POWRGYM.com. Dr. Chellam is a board-certified internist who is also board-certified in integrative and holistic medicine. The mission of her functional medicine practice is to prove that diminished health and vitality can be reclaimed by just about any proactive person at any age. Dr. Chellam practices in Novi at the Holistic Icon Clinic, where she incorporates nutrition, fitness, hormone balance, and permanent weight control. All right, families, let's jump into today's interview. Welcome, families, to the interview portion of today's podcast. I'm honored to be joined on the show today by Dr. Chellam. Welcome to the podcast, Doc. It's so great to have you.
Thank you so much, Dr. Kyle. I really appreciate this opportunity.
Absolutely. Well, Doc, I'm excited to jump into our discussion today on how you help women, mothers, and families elevate their health and family wellness lifestyle, especially as it relates to the growing field of functional medicine. But before we get there, there are two questions that we always ask every guest. So help our listeners and myself get to know you more by telling us what family looks like for you.
Well, my family probably is the best thing. My husband works for Toyota here in Ann Arbor, and I have two kids, an 18-year-old and a 16-year-old. So a son and a daughter. So the best of all worlds.
Awesome. Love that context. Love that environment, just so that people can kind of get to relate to each other here on the podcast. You know, we're real people having real relevant discussions, I like to say. So, and again, yes. Doc, you know, we like to say here on the podcast that we are smitten with the mitten. So do you have a favorite part about Michigan, or, you know, anything that the mitten has to offer?
Absolutely. The sky. Have you ever noticed the sky through the seasons?
Yes.
That's the most beautiful part of Michigan. I don't think you can see this kind of a sky anywhere else.
I completely agree. I'm actually just kind of cycling back to when I lived on the western side of the state here, and just those sunsets, those sunrises, especially around Lake Michigan. Yeah, those are extremely beautiful. All right, Doc, let's go ahead and get more in depth, because I really want the women and the mothers listening to benefit from your experiences, your expertise, and your unique perspective. So, Doc, to help frame our discussion for today on functional medicine, can you establish and articulate what the problems are with the standard medical model? Is the standard medical model for everyone?
The best way to answer this question is to ask another question. When I ask people, do you think we have the best healthcare system in the world? They always say yes. And then when I ask them, so do you think we are the healthiest nation in the world? It's always a resounding no. So there's a huge disconnect right there. And when you look at where our healthcare system excels, it's in crisis management. So when you have an acute problem, I don't think you want to be in any other place other than the United States, whether it be the ambulance, our paramedics, our emergency room, or acute care management. However, when you put those same principles into chronic care, when that becomes an issue because people don't know, or they kind of think they are sick because that's the way it should be. We never address the root cause of why they are ill. And I always say there are 4 reasons why we are sick. And we actually know it, but we do not want to change it.
Mm-hmm.
And the very first one is lifestyle. Everybody knows this. People always tell me, I don't exercise enough, I don't eat the right things. We kind of get in life what we tolerate. So a lot of times, women particularly, I always say this also about women and men, there's a huge difference. Women have symptoms. They kind of tolerate their symptoms, whether it be hair loss, whether it be fatigue, whether it be weight gain, whether it be insomnia or inability to sleep at night. They will tolerate it, and then they will seek assistance from their friends or family, try to do dabble in a lot of resolutions like essential oils or herbal medications. And when it gets to them, then they come to the doctor, and then they get on a medication. The conversation never happens as to why are you having these problems. It's
Right.
almost like, oh yeah, the problem is now fixed. And that's pretty much it. And then you're on these medications for the rest of your life, and you believe that's what you need to address the problem you have.
Right.
So that's usually the number one. Number two, we assume that kind of care we need to get is what the insurance will cover. And I don't blame people for thinking that way, because we spend so much for our insurance. A family of 4 spends easily $1,100 a month.
Mm-hmm.
And so when you go to the doctor, your expectation is do what you can, and hopefully my insurance whatever you do is what my insurance will cover. But when you really look at it, insurance covers 2 things. One is drug, and the other is surgery or catastrophic care.
Right.
Even now, if you look, a lot of the cost of your care is being shifted to you in the form of deductibles, in the form of co-insurance, co-pay. So in many ways, when people tell me the first $10,000 they actually have to meet before the insurance can kick in, it actually discourages them to seek help for themselves. They want to avoid going to the doctor. And that's the other reason why people are getting sicker than they should be by the time they get into the medical system. And then when they get into the medical system has only one way to address this issue is with the medication. Mm-hmm. Because our goal is to relieve pain immediately, instantaneously. So the only way we can do that is with the medication. And the last thing is there's so much of information overload. The first doctor they go to is Dr. Google, right?
Right.
And when you go to the various websites, you are inundated with so much of information. It's almost chaotic. And whatever appeals to you, appeals to your value, you will choose that, but that may not be the appropriate one for you. So by the time they get into that mode of where they begin to accept their disease, they've tried a lot of things, and it's almost like they've given up. And what I see is a good portion of our patients struggle with a lot of symptoms, which can be resolved. However, when these symptoms are allowed to continue, then it becomes, from a dysfunction, it becomes a disease.
Right.
So I really think that's what I've broken it down to. Why, what is wrong with our healthcare system is how we perceive it, what we're willing to tolerate, and how the healthcare system currently responds to the problem is the way they respond in an acute crisis. Because in a crisis, yes, you have to take care of the immediate symptom or problem. You put a stent, the heart attack, you abort a heart attack and actually save a life. But the medication after that you have to get on does not really address the root cause of why you had the heart attack. You got to go back and see what really caused it. And I think that's where we're missing the boat.
Absolutely. I couldn't agree more. Just going back to what you had said, the United States, North America here, there's no place that I would rather be if I needed, a liver transplant or a heart transplant or a triple bypass or any kind of emergency type care. If I get in a car accident, I tell my patients this all the time. Take me to the hospital. Don't take me to the massage therapist or the acupuncturist or the chiropractor or the functional medicine office.
That's right.
Help me get out of pain. We need that emergency care. And to your point, our insurance model, with our employers, we're set up for this insurance. That insurance pays for that emergency care, which is great. I mean, it's very expensive. But also to your point, Doc, we don't have a good model that really takes care of our wellness, that really takes care of our functional health. And I just really appreciate the way that you articulated and that you outlined, the problems that we're seeing with just this standard medical model of a pill for every ill or just, drugs for every symptom. Or surgery, so there's definitely issues here. I want to circle back real quick before we get into the solutions that are offered by functional medicine. Doc, do you see a lot of people who they're having issues with their health? They're having, symptoms like you talked about, whether it be their chronic fatigue, can't sleep, can't digest, brain fog, all these things, but they'll go to their doctor, their MD, and they'll do these lab tests, and their lab tests come back in the normal ranges. Do you see a lot of that?
Absolutely. And that's always the case, particularly with chronic fatigue and weight gain. Women always come to us saying, I know it's my thyroid.
Right.
And of course, their thyroid tests are always normal. And I always tell this to women, both your doctor and you are right. And that's the whole problem with the system. Is we look at the end result. Lab values can be very inaccurate because we say when you look at the different hospital systems just here in the suburb of Michigan, you look at Providence or St. John's, or whether you look at Henry Ford, or whether you look at the DMC, everywhere the lab values are different.
Right.
You could be normal in the St. John system, but maybe abnormal in the Henry Ford system, because when you look at it, people who go to get their blood work done are essentially not in the best of their health. They have some symptoms. So when you are in the 95% percentile, you're in that range, are you okay with being normal? Because we know 95% of Americans are not necessarily healthy, but we accept that. What I think really needs to happen is we have to hear about the symptoms, and we have to really get to know the person having the symptoms rather than the symptoms themselves. And I think what we do is we look at the symptoms, we look at the labs, and we come to a conclusion. So the complaints or the person having the complaints does not come into the equation. And that's the big missing piece.
Gotcha. That makes so much sense. And one other point I want to make here, Doc, is, and help me understand this too, because as a chiropractor, this necessarily, isn't my world or my day to day. I don't have, 15, 20 years of experience in this realm like you do. So correct me if I'm wrong, but, let's say someone is experiencing issues or symptoms like we talked about, and they do this lab work, okay, and their lab tests come back in the normal range, but the doctor can kind of tell that maybe their labs are going in the direction of a pathology or like an issue that is, coming on down the road. But the doctor is kind of in a bind because the insurance companies or the, all the strings around what they can do say that, no, if the patient doesn't have their lab values in the pathologic range, then you can't administer any treatment. Is that right?
Absolutely. It's
Yeah.
very much so. And I see this especially with diabetes.
Diabetes, yep.
Yeah, so you can have a fasting blood sugar of 96, which is well within the range, and a hemoglobin A1C at 5.8, which is well within the range. Diabetes is when it's 6.3. But in the fasting state, if your insulin is 64, when it should be 6, you are developing insulin resistance.
Right.
At that point in time, I should be able to intervene and say, hey, we got to do something different here so that you do not become a diabetic 5 to 6 years from now.
Yes. And that model of prevention is what I think is in such great demand right now. Real quick, before we get to our discussion on the solutions that functional medicine has to offer, I would just insert one thing here, Doc. I have hope. I have a lot of hope. Have you heard of health savings accounts? Have you heard of these FSAs and these HSAs? Things like that?
Yes, absolutely. The HSA actually will cover a lot of the services. The flex savings account is a little different. I find I filled a flex savings paper, and I'm going to paraphrase what was written at the end of the paper at the bottom, just where I have to sign. I had to certify the services I provide will not enhance the health or is not used to extend the person's life, but is actually being used to treat a disease process.
Okay. Yeah.
So that's even that statement is very it was very difficult. Yes, very discouraging.
Yeah, it's very discouraging. So, all right, Doc. Well, now that we've kind of, like I said, articulated and established, all of the problems that we're seeing in our culture today with our medical model, let's go ahead and jump into a discussion on what is functional medicine and what are the solutions that functional medicine offers and how does this integrate with the family wellness lifestyle?
So when as functional medicine as opposed to dysfunctional medicine is the best way I can explain it is people understand what classic medical care is. When you go to a doctor for your annual physical, we're actually trying to detect disease. That's the classic preventive screen. So when I do a mammogram, I'm not preventing breast cancer. I'm actually detecting early breast cancer.
Right.
So there's a difference between when you're trying to detect disease and when you're trying to prevent disease. Preventing disease means I'm going to look for those features which tell me, hey, this person is headed in the wrong direction as far as their health goes. So when I see a person whose weight, let's say, is absolutely normal, but then she's complaining to me about these early morning headaches or abnormal menstrual cycle, or she just has stiffness when she gets up in the morning, or fatigue when she gets up in the morning, or inability to sleep, or has just 3 or 4 hours of sleep and wakes up frequently at night. These are all signs that everything is not well.
Right.
It does not matter what her labs look like, does not matter what her body mass index is, and does not matter that she actually can function and do her day-to-day work, whether it be taking care of her family, going to work, and taking care of both these. So for me, those symptoms mean a lot. It means the body is flagging something. Like, for instance, a heartburn. Most of us have access to Tums or over-the-counter Prilosec, and we take it, the symptom go away. But actually, your body was trying to tell you something. So instead of the whack-a-mole approach, what functional medicine does is looks at the symptom and asks the question, why do you have it? What is the root cause? Are you not producing enough acid? Are you not digesting your food? Is there a lot of stress? Because stress by itself causes inflammation. And when there's inflammation, you pretty much are converting all of the resources to try and get rid of that inflammation, and nothing else functions. So you really have to address the person as a whole, number one. Number two, you have to have a systematic approach. Number 3, you got to do diagnostic testing. And a lot of times, even as a physician, even though I may know why the person is having the problem, the diagnostic testing that I do is to engage somebody in their own care. I asked a young lady the other day, she's 38 and has a lot of stiffness in her back, and she brought her MRI saying, I have arthritis. And I said, at 38, you don't get arthritis.
Yeah.
And trying to ask her, and I said, if I were to tell you to eliminate a few of the inflammatory foods, would you? She said, if you show me that those foods actually cause inflammation in me, I will.
Mm-hmm.
So it's almost like, yes, you have to do some diagnostic testing so it actually imprints on somebody's mind, hey, this is what I need to do because this is what my body is struggling with.
Mm-hmm.
So functional medicine really is a very systematic approach, addressing the root cause of the disease, managing not the symptoms, but the root cause. And you have to take the person as a whole, which means you have to address their life and them and their symptoms.
Fantastic. I love everything you're saying. Root cause, prevention. Along those lines of prevention, you share a fantastic video at your dinner talks, actually, from Health Canada. And we can actually drop a link to that video in the show notes here. But it just really outlines how the end-of-life care, the senior living assistance, is that really where you want to be? Or do you want to be, going on bike rides with your spouse and playing with your grandchildren and just be alive, thriving, and able to move and think and do all these things, when you're in your 60s, 70s, and 80s? You don't always have to be in that model that's so prevalent now with these nursing homes and these senior living cares. I'm not saying they're bad, but another point that you make, Doc, is that they are extremely expensive. You were telling me, 1 month of end-of-life care like that, is several $1,000s. And when you extrapolate that over, 12 months out of a year, and then what if you're there for, 10, 20 years? That's a very expensive way to spend the last, 5, 10, 20 years of someone's life. When you compare that to the prevention work that you can do now, it's like night and day. Would you agree?
Totally. In fact, I tell people the goal of our practice is help you leave a legacy for your kids, not medical bills.
Mm-hmm.
And unfortunately, people don't see it that way. And the only other way you have to look at it is, let's say you didn't pay taxes to your IRS for years together. You're going to be paying a lump sum with interest when you finally have to do it or you're made to do it. And the same thing with health. Unless you invest in your health from the get-go, when your very first symptom arrives, you really need to seek complete resolution, not just management. You'll find that the earlier you begin this journey, it's much cheaper in the long run.
Mm-hmm.
And I think most people don't think about spending on themselves because they're already spending so much for insurance premium. But however, I always ask this question, if you had an expensive car or your home, something happens to it, you don't think twice about spending money to get it fixed. And I don't know why we do not give ourselves that importance.
And I think people have to realize as well here, Doc, that these problems don't correct themselves overnight. The solution is often, making changes and improvements and enhancements in our lifestyle. So that's why I talk about, the family wellness lifestyle. So functional medicine, chiropractic care, all of these things, really have to be an as we go type thing, not like a dramatic shift overnight that, you're going to do one thing and everything is going to be fixed with your health problems. So I think people need to understand that as well. Now, Doc, oftentimes I feel like what makes these conversations so relevant and so powerful is just briefly getting a better understanding of your story. So if you don't mind, would you mind sharing your story with us? I believe, your thyroid was involved, with your journey. Can you tell us about that?
Absolutely. So when I started out in private practice, which was in 2010, I had actually resigned from the Veterans Administration because the thing that caught my attention at the VA was that we followed the standard guidelines in management of diabetes, heart disease, hypertension. And what I found is the list of medications just kept increasing as the guys came in to see me, and I was following all of my guidelines. And it occurred to me that maybe what we need to do is lifestyle. And to me, lifestyle was fitness and eating healthy. And when I started my private practice, there was a lot of stress involved in starting your business, especially when you don't know the business aspect of medicine. And around that time, I started gaining some weight, having some insomnia, losing hair. And at some point, I started sounding like my patients. When patients come and say, I'm just gaining weight, but I think I'm eating healthy. And I felt like, that's me. And so I decided to do my own blood work, and everything seemed fine. Just my TSH, which is the thyroid stimulating hormone, seemed a little off. So I did go to an endocrinologist at University of Michigan, and she looked at it. She did an ultrasound of my thyroid and said, it may or may not be your thyroid, but how about we just check back in 6 months? Mm-hmm. By this time, I had severe migraine headaches, which were about 2 or 3 a week. I've always had migraine headaches from the age of 11. And I've had what you call seasonal allergies since I've come to the United States from India. And I've always used Flonase. So to me, the frequency of the migraine headaches actually bothered me a lot. And around this time is when I was introduced to functional medicine. And actually sitting in that course for the 5-day course, I realized what I had was Hashimoto's thyroiditis.
Okay.
And I actually did my blood test to figure if that's what I had. And I did have very high antibodies. And the more frequently I did my thyroid tests, I could see that actually I was fluctuating between high and low. And it was going along with my insomnia and my fatigue. So when I started this journey, I remember going to holistic doctors, looking up online, and there's so much of information. And people think there's one thing that will fix this, whether it be Armour thyroid or WP thyroid or natural thyroid. What I actually had to do was to rebuild my health. It took me about 18 months, and I will tell you, even today, it continues to be a journey.
Absolutely.
A lot of times we're stressed. Our life is very stressful. You have family, you have a career, you have clients you serve. There's always constant stress. Some days are better than others. But what most people need to understand, their health is like wealth. When you are trying to amass wealth, you really have to focus on where your money goes, where your money comes, how you invest it. It's the same thing with health. Sickness is a habit. Health and wellness has to be sought. So I always tell people when they join our practice, this is a journey. This is not a point of care where I provide a service and I fix you. This is you and me working as a team. We get you to the right path, and you have to continue on that path and keep in touch with us so that you don't fall off the path or get lost somewhere in this journey. So I hope that answers the question, because for me, when I started with my thyroid issues, there was not one thyroid medicine that fixed me. I had to actually get to fix my gut. I had to get to fix my hormones before. And then I realized I don't need my thyroid medicines in the long run. And the best part of it is I've not had migraines, which I've had from the age of 11, at least once a month. I've not had any nasal congestion or seasonal allergies. And that's what got me thinking. It's when you get the body back to function, you actually lose all of those things that you think is a part of your family genetics, because migraines do run in my family. And so that's pretty much how passionately I feel that most people who come to me, you really want to get to the root cause and get on a different journey and stay on that path.
Outstanding, Doc. I just want to thank you for sharing your story. Thank you for being vulnerable. And I just really appreciate the way that you're able to connect with people who actually are going through this, the same way that you did, and just be this like beacon of hope, this lighthouse that can guide people through. And you can relate to them and say, look, I've been in your shoes. I've actually experienced what you're going through. Let me help you navigate these waters, go through this journey together so that we can actually correct these problems. And like you said, it took you 18 months? This takes a long time for some people to really get these major corrections. So I just think that's a great encouragement for people.
Thank you. Thank you for saying that.
So, Doc, one of the purposes of the Michigan Family Wellness Podcast is to be an audio library resource for women and mothers who want to learn more about elevating their family wellness and increasing their resiliency, or that strength to adapt to the stress and challenges in their life. One of the ways we accomplish this is by asking our guest for practical applications. Now, I know we've talked about a lot so far, but Doc, real quick, as we wrap up here, in the context of today's discussion, what can the women and mothers listening today start doing right now to elevate their health and family wellness lifestyle?
So the most important thing is really acknowledge that you have a problem. There are some things we're willing to accept, some things we will not be willing to speak about. A lot of times you have to acknowledge you do have a problem. When women come to me and say, I'm fine, everything is great, and when I ask them, so you don't take any medications? And they say, oh, no, I just take a little medication for my blood pressure and my cholesterol. That is a problem. So I think, number one, acknowledge the problem. Number two, acknowledge that you get in life what you tolerate. So if you're not willing to tolerate this, something has to change. So you need to understand that if you have to change, you have to seek the right information. And the third thing is, which I found very helpful for myself, is actually to partner with somebody who can coach you to wellness. And a lot of times women go to psychologists, and nothing against psychologists, I think they do a great job. However, we're kind of have a lot of regulations when we try to go through the the medical system. If you have been seeing your psychologist for 15 years and still have the same problem, I always tell them it's time to fire them. And that includes me. If you've been working with me for your high blood pressure for 5 or 10 years, it's time to fire me. Mm-hmm. We have to really seek a resolution. So number one, take time out for your family. Actually, if you can bring back cooking into your life,
yes,
a lot of times disease will completely go away. And when I'm not talking about, Sara Lee's semi-homemade cooking, but I'm really talking about cooking.
Absolutely.
And really acknowledging when you have a problem that you have to seek professional help and not just tolerate your symptoms.
Outstanding, Doc. Thank you so much. Now, Dr. Chellam, if I'm listening today, if people are listening today and they're resonating with your message about functional medicine, where can they go to find more about you and your functional medicine practice?
So the best way to find us is we have a very nice web page with a lot of information. It's holisticicon.com. So it's Holistic and Integrative Center of Novi. And I usually tell people, really seek us out if you are actually trying to resolve health issues. For managing health issues, there are a lot of us out there. But if you want to resolve, where you want to partner with a practice, we're probably one of the best that you can find in Novi. If your issues have affected your life, your relationships or ability to work, then that's the kind of practice you want to partner with. And are you really motivated to change? A lot of people want a quick fix for their for their problems. And I always tell them, we're not necessarily a quick fix. We don't fix anybody. Most people have a journey to wellness. The other way they can contact us is to call us. Sure, it's 248-773-8640.
Fantastic, Doc. I just love the way, you equip and you empower the people in your practice to really take control of their health and get down that path to wellness, that journey to wellness, on their own, really, with your guidance and your coaching, essentially. So Dr. Chellam, I want to thank you for coming on the podcast today. You are a wife, you're a mother, you're a doctor, and I just think that there's such great synergy between functional medicine and chiropractic care, and that's why I wanted to bring you on the podcast today. You have brought the value. Thank you again. I acknowledge you, and thank you just for giving back and becoming part of the MFW family.
Thank you so much. I really appreciate this opportunity, and I hope the information is useful to your listeners.
All right, families, what'd you think? We'd love to get your feedback. If you would like to email me about anything you've heard on this or any previous edition of the Michigan Family Wellness Podcast, you may do so by writing me at drkyle@michiganfamilywellness.com and take full advantage of the Family Wellness Lifestyle audio library at michiganfamilywellness.com. Thanks so much for tuning in this week, families. Have an awesome week, and remember, we can do far more together than we could ever do apart.
Now that you've been equipped with the latest in family wellness solutions, we want to encourage you to apply these strategies right away. But the thing is, there's still so much to learn. Connect with Dr. Wallner's Chiropractic and Nutrition Office by going to michiganfamilywellness.com and click the newsletter sign-up button to join the informative and supportive community of chiropractic wellness. You will also receive as a gift from Dr. Wallner a copy of Michigan Family Wellness Solutions, an invaluable resource containing dynamic tools to elevate family health and vitality. Michigan Family Wellness wants to thank you for being part of today's podcast. Please subscribe to our podcast on iTunes and give us a 5-star rating and review.